Good evening. It's Monday, August 3rd, and I can't believe it's already the beginning of August and we're 3 days into it. I just got back from doing a quick 20-minute walk this evening, which I hope that all of you are continuing to move and be healthy. We're still in phase 2, so, and I know from seeing most of you, or a lot of you, in the past 2 months since our office has reopened, that everybody's staying pretty safe and hunkered down. So make sure you're moving and exercising and continuing to stay healthy. Today we're going to talk about something a little bit off the direct topic of sleep. I wanted to bring to you an update on the COVID-19 virus. I think I mentioned a few videos back that I am following a physician out of Harvard University, Dr. Leslie Fang. He does a lot of work with dentists and physicians, kind of managing or teaching dentists to manage the medical side of treating people. And so he's been doing a 2-hour lecture every month on COVID-19 update. He presents the science and kind of just what are the new facts about the virus. So I think it's important for me to bring that information to you. There was a lot of information, so I'm really going to give you a condensed version. But again, there's a lot of fake news out there, and I feel very confident that what Dr. Fang is presenting is kind of the latest in the research and reliable information at this point, again, with information changing on a daily or even hourly basis for that matter. So I want to start out with some information that the virus that we are seeing that has really caused this pandemic is what they're calling the G form of the virus. It originally started as a D form, but mutated into what is now a G form. This has been since the inception in the United States, so it's not that it has mutated since it has been here in the United States. This G form was actually, my understanding is, what the form of the virus when it presented here in January. The important thing to note about this mutation is that it is, number one, responsible for the pandemic. It is less symptomatic than the D form, but it is more contagious, hence why we have a pandemic. So, and it transmissibility can be through asymptomatic. So 40% of patients who test positive for COVID are asymptomatic. So that was really a shock to me, actually. But being asymptomatic, you can still and will transmit the virus. 75% of the disease transmission occurs when patients are asymptomatic or in their pre-symptomatic stage. So pre-symptomatic is from day 0, where you contracted the virus, to day 4 through 7, where you start showing symptoms. It's in those days that you are pre-symptomatic that you are most contagious. Now, with that being said, people who actually come up with symptoms, particularly a cough, are the most contagious because they are transmitting the virus through those cough droplets, which can travel significant distance, much more than 6 feet, if you should come in contact with cough droplets. I thought it was also interesting that he made a point to say that asymptomatic people, it takes them longer to clear the virus, so they can be contagious for up to 45 days, which I thought was interesting. What dictates whether a person is asymptomatic or symptomatic is that people who are symptomatic have more of what they call a immune storm. So their body's immune system reacts to the virus at a much harsher capacity, which then causes the symptoms. This virus, it was originally thought that it was a respiratory system virus. They're now finding that it basically can affect every system in the human body. So it affects the circulatory system, liver, spleen, kidneys, of course, lungs. And so it is just actually brain. I think there's been some cases of like an encephalitis. So this virus is responding in everybody differently. And so again, I thought that was very important, because if you are, really watching how you're feeling, don't just take, oh, I have a cough, so I may have COVID, but I'm having GI problems, so I don't. Because it is, again, affecting all the systems of the body. With that being said, one hallmark symptom that seems to be showing up in most everyone who tests positive for COVID and has symptoms is the loss of taste and smell. Now that's a new loss of taste and smell. So if you are someone who, for some other health reason, had a decrease or a complete loss of your taste and smell prior to COVID, then of course your lack of taste and smell is not COVID related. But if you have been fine, your sense of smell and taste have been normal, and then all of a sudden you notice that those two senses are decreasing or completely gone, the chances that you would test positive for COVID are significant. All of you know that my husband had COVID back in March. That was his first sign he knew that he was going to test positive, as he lost his sense of taste and smell. And to this day, so we're talking 3 months or so later, he still does not have those two senses completely restored 100%. They're of course not as bad as they were when he was in the throes of having the virus, but they are significantly decreased. So sense of taste and smell is a hallmark symptom. Now, there was the golden triad of cough, shortness of breath, and fever. Back at the beginning of this pandemic, that's what physicians were looking at. The CDC, as of last week, added these additional symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, and then of course loss of taste and smell. Now, we can look at that list and go, well, that describes a cold, that describes the flu, it describes, some bacterial infection. And that is true. 82.5% of people who present with these symptoms test negative for COVID. So of course be conscientious if you have, a runny nose, a cough, any of those types of signs, a headache, a sore throat. But keep in mind that you should get tested, but you will not necessarily test positive. So it doesn't mean you have COVID. I would, though, quarantine, get tested, and stay away from anyone until you have those test results. The other thing that I found very interesting is there are people called super spreaders. So these are the people that are actually transmitting 80% of the virus. And these are people who may be asymptomatic but have such a viral load that they are contagious. And so you want to be careful when you're going to be even in small groups of people. Which brings me to what's going to decrease the transmissibility of this virus. If you have a mask on and you are speaking with someone who has a mask on, the transmissibility of that virus decreases to 1.5%. That is a real fact, a scientific fact. And so I know there's a lot of people out there promoting that we shouldn't have to wear masks, but for those of us that are being conscientious about contracting the virus or transmitting it, wearing a mask is going to decrease that transmissibility significantly. The other thing that's important is air ventilation. So it's why we're being told, when you're outside 6 feet apart wearing a mask, your chances of getting the virus are much less than if you are in an enclosed area. Places where the transmissibility of the virus is being seen the most are, of course, in homes, so among family members, and in transport, buses, trains, airplanes, that type of thing. So transportation and home and enclosed areas are where, again, that transmission is occurring the most. There are, I guess, one good news is that, well, let me backtrack for a second. Spanish flu, when this does go into a vaccine, Spanish flu back in the early 1900s, There was no vaccine, no antiviral ever found, but that virus was wiped out because of personal hygiene, people wearing masks, and people staying distanced. So it goes back to, if we follow those three, I want to say simple rules, although they are getting harder day by day, I do understand that, but if we can follow those rules, then the chances of this virus decreasing is significant. It's when we have, everybody against following those rules that we're just going to see this virus continue to rise. Or we have a vaccine for it, which Dr. Feng mentioned is happening at a pandemic speed. There are several companies that are in phase 3 trials for a vaccine, so that's encouraging, and he's hoping or projecting that hopefully by the beginning of 2021, there will be a vaccine in place that would be safe for us to obtain. Last but not least, there are 3 medications that are being repurposed in hospitals for people who come down with COVID and have to be hospitalized. So that was good news as well. They are showing promising effects on people who are symptomatic, end up in the hospital. These 3 medications, it's remdesivir, dexamethasone, and inhaled interferon. So those are 3 medications that are being repurposed. And I think that covers my update on COVID. A lot of information. I could have given you a whole lot more, but those are the takeaways. And I think the biggest thing is continue to do what you're doing, being safe, staying at home, wearing masks, your personal hygiene, washing hands, not touching your face at all, and just being, if you're going to be around people that you know have also been practicing the same safety steps or measures that you have been. Stay healthy, stay safe. If you have any questions, you can give me a call at the office, 253-514-6076. Again, I'm just trying to keep you updated with real information on this virus. I hope you find it helpful, and I hope you have a good rest of your week.